Great. Okay, hello and welcome. It looks like we are live. This is a very exciting day for us because it is the launch of Metabolism and the Mind here at Nutrition Network and to the public at large, which is a really very exciting topic, of metabolic psychiatry or ketogenic metabolic therapy, which is really a growing and blossoming area in the field of therapeutic carbohydrate restriction, and I suppose in the field of psychiatry and mental health. Um, and you'll see at many conferences, you'll see that they're having specific days that are allocated
Mhm.
to ketogenic diets and mental health or metabolic therapies and mental health. And you'll see books coming out left, right, and center, such as Palmer's Brain Energy or Georgia Eads, a book that just came out now. And so I think it's very timeless that we launch Metabolism in the Mind at Nutrition Network today. So please, if you haven't already signed up for this course, please do. Um, it's a focus around the essential role of metabolism in mental health. And we have got an amazing lineup of speakers, one of which we have got with us here today. Denise Potter, who is a registered dietitian. So welcome, Denise. We are so happy to have you and discuss this topic in a little bit more depth on this prestigious, exciting day of our launch.
Yeah, thanks for having me.
Such a pleasure, such a pleasure. All right. So let's get started. I'm going to introduce you briefly, Denise, before we get into all the juicy stuff that we're going to discuss today. So Denise Potter is a registered dietitian nutritionist. She's been a registered dietitian nutritionist for 33 years already. And for the past 17 years, she's been focused on ketogenic medical nutritional therapy. So she's definitely a pioneer, one of the pioneers in the field. She has been privileged to speak to, train, and educate professionals and individuals around the globe on therapeutic ketogenic therapies. And she strives to provide a client-centered, personalized therapy counseling, as well as education. She has a passion for helping underserved populations benefit from the ketogenic diet, and she's even an author of the migraine diet, a ketogenic meal plan for headache relief, which we know all about ketogenic diets and even carnivore diets and how they've really been coming to the limelight when it comes to migraine relief. So
Mm,
welcome, Denise. It is wonderful to have you.
Thank
Wonderful
you.
to have you. And I was just actually telling Denise before we came live how much I thoroughly enjoyed her presentation because Denise's presentation is really wonderful in that it is a practical guide to using ketogenic metabolic therapies for treating psychological and neurological disorders. She touches on the evidence, yes, and we go much more deeply into the evidence with our other speakers, such as, Shabani Sethi from Stanford or Dom D'Agostino from South Florida University. So it's not that we don't have that. We definitely have that. And Denise also touches on that. But what really makes her lecture stand out is she explains how clinicians can harness this very powerful therapy to make real life changes and real differences in their patients' lives. And she emphasizes this right at the end of her, on the second half of her presentation, where she presents case studies, which I also am hoping to discuss a little bit, in this chat, and give you guys a sneak peek into the real changes that Denise and other clinicians have been finding um, in their patients, in real life people
Mhm.
whose lives are so incredibly changed.
Mhm.
So Denise, maybe we should even start there before going into how to do it and all those kind of things. Maybe we should start with why we're even looking at this, maybe. Why do we need ketogenic or any kind of metabolic therapies when we have got good old drugs? You know, we have SSRIs and we have benzodiazepines and we have antipsychotics. Why should people with depression, bipolar, schizophrenia, anxiety, any of these mental health conditions, why wouldn't they just take medication to sort themselves out? Why would they be looking at something else?
Well, in my case studies, you'll see two of the people I have the number of meds. One of them had tried 28 medications and they didn't work. And then the other one, I believe, tried 24 or 22 plus. I forget the exact number. But frequently the medications don't work. And I mean, but sometimes they do. And if they do, that's great. If someone
Yeah.
is well controlled on a medication and the side effects
Mm,
aren't tolerable, then that's great. Go ahead. You know, there's no, I've no nothing against them. But sometimes the side effects are intolerable.
mm,
Sometimes people gain tremendous amounts of weight, which puts them in a metabolic crisis,
yeah.
basically. And I bet some of the other people will touch on this, but and I've heard numbers, you know, between 15 and 25 years of lost life, like shorter lifespan with some of these conditions, such as bipolar or schizophrenia. And sometimes it's because of suicide or different reasons, of course, that they might die early, but they also die early because of diabetes and heart disease, purely because they
Wow.
gained 70, 80, 100 pounds on
And the
medication.
medications are aggravating this, right? I mean,
Right,
oftentimes.
right. The list, I didn't use the slide on this presentation, but if you just Google the side effects of pick one thing, an SSRI, the side effects and any medication, you know, has a million side effect potentials. And so what's I guess and I'll launch into this, it gets frustrating sometimes when people are opposed to ketogenic therapies, they'll say, oh, you know, that's bad for you, or oh, it's not good, it does this, it's so much fat, and they have different arguments. But then when you look at the list of medications and you say, well, what about all these dysfunctions and the weight gain and the metabolic, you know, problems that the medication cause? Let's weigh these out versus a risk of a little higher LDL or a higher LDL, or the risk of kidney stones, which is actually very small, or the risk of, I don't know, the risk of feeling better. I mean, it gets kind of frustrating because the side effects from keto are relatively few and relatively minor, although I don't want to totally underplay them. If it's managed well and we keep an eye on people and we're watching their labs and we're making sure they aren't, you know, doing things improperly, the side effects are, you know, almost they're not bad. You know, I don't say negligible, but very few.
So, wow, Denise, I think you've made a very compelling argument for why we need to consider alternative therapies. If medication worsens metabolic conditions such as cardiovascular disease risk, metabolic disorder, type 2 diabetes, and then thereby shortening life. And then you mentioned there's a very high medication or treatment resistance in many patients with some, you mentioned your case studies with 28, 24 medications they've tried. This must be decades worth of trying to get better unsuccessfully. And then, yeah, sorry.
Yeah, oh, I was just thinking because sometimes we take this back, and even for the people that medications may work, there's only going to be, I don't know the percentages in psychiatric. Of course, I see the people where meds didn't work or they want to try diet before meds. I don't see all the ones, they don't need me, that the medications worked. But in epilepsy, we know, and these, and you know, then Dr. Palmer will talk about the bidirectional relationship between the mental health and the epilepsy and can tell you more about that. But with these similarities, in epilepsy, there's a 30% non-response rate for medications. And once we get to the point of trying after two medications, when you get to the third, fourth, fifth medication, this is in epilepsy, the chances of those working are less than 5%. In that condition, that's again, different condition, but similar. And so I wonder when you see these people that have tried over 20 medications, it seems as though that those percentages are quite similar, right? That the likelihood of them working once you've tried the next and the next thing, and it doesn't make medications bad, what it means is for some reason they're ineffective. And we have to have another treatment because these people are literally losing their lives, I don't say wasting their lives, but their lives are being wasted because they can't live their lives. They can't go out, they can't work. I have people that, and you know, I talk about that they work now. I have a young, you know, woman with schizophrenia who she's working a full-time job. And I can't talk to her now until 9 p.m. Like, I need to get to bed, but she's at work all day. And I've seen statistics where with schizophrenia, it's 10 to 15% ever can hold the job. So the fact that she went from being in psychosis to working a full-time job, that's
You,
amazing.
wow, you're making, I mean, this is making a real life difference
Mhm,
to these people. And I just want to emphasize that because I think we forget with every condition, whether it's type 2 diabetes and we say, well, this many people have it and, it's a chronic condition and, you lose this, this much work, economic income or contribution, and then you lose this many years of your life. But people don't think about what that really means to the people who are suffering and the people around them. And so I think maybe if you can share with us maybe one or two cases before we even dive into what this therapy is, so
mhm,
that people can truly understand the suffering
mhm,
that so many people are experiencing, because this is a very common thing. Mental health conditions are incredibly common, whether
mhm.
it's depression, anxiety, whatever it is
Yeah.
incredibly common. And and the suffering is invisible to the majority of people. They walk around, they have no idea what's going on in people's heads, how they might be wanting to kill themselves, how they might end up killing themselves, how they might feel hopeless, how they might not be able to hold down a job, like you said, Denise, where they're
Mhm,
having to be supported into their 40s, 50s
mhm,
by their aging parents who are constantly worried about what's going to happen to these children when they've passed. You're dealing with rages, you're dealing with tears in the home, you're dealing with complete mayhem is how it feels.
mhm.
No calmness in the home. it's
Yeah.
it's like living a nightmare for many people and their families. So can you share some examples with us of how that really looks and how that has changed on the kind of therapies that we're
So
discussing?
what happens, I guess what we see in some of the best things that I ever hear from families is when they say, I got my son back, or I got my daughter back, or or when they can see those changes start to happen. And I'll say that they tend to happen slowly. Sometimes people are very frustrated. We hear the great stories and we all want to brag upon on our best stories, right? Of course, I bring you my best case studies, right? There are other people that didn't do as well, and there's some people that failed, that didn't work at all for whatever reason, or they couldn't stay on it. But I'll get back to the point. But as they walk through this, I was talking to somebody, I said, well, as I try to explain it, I compare things to epilepsy a lot because this is how things work. They said someone might have a seizure that lasts 15 minutes every day. They have three seizures that last 15 minutes every day. And now they have three seizures every day, but they last 12 minutes every day. And then later they last 11 minutes every day, right? And so these are the kinds of benefits we see. So I try to explain that to someone in mental health conditions. I had one lady in this, and I almost cried when she said this. We had a class, this group class, and she said, and we were about 4 weeks in to the class. So she'd been doing keto for 3 or 4 weeks. And she said she had severe depression. And she said, I had a positive thought today. And I'm just
Wow.
like, I mean, you talk about the mayhem, or not mayhem there, but just the depression, and how can she even survive and walk through a day? And I can't relate to that. I've been depressed before, but I've never, not like that, right? And I just couldn't even imagine what it was like for her to say, like, this little glimmer, I think of the sun, and this clouds in the sky, and this glimmer of sunshine came through for her, and she realized that there was something on the other side for her. There are positive thoughts for me. There is a positive life for me. And 3 weeks in, that was her benefit so far.
Wow.
Okay, so those are the kinds of things, and helping people to understand that it can take 3, 4, 5, 6 weeks, and sometimes you don't recognize this. I try to get people to do some tracking up front. We try to do a little bit of a few inventories when we can ahead of time to know, where are you? Because sometimes they don't know that they feel 40% better,
Yeah.
because they still don't feel very good.
Yeah.
40% better when you feel like
Mm.
killing yourself is what I don't, 3 days of the
And
week, I don't feel like killing myself,
yeah.
right? So it's
And
only,
Denise, I just want to interject there because I think this is a really, really important point that you're making. Um, us humans, we have got very bad memories. And
Mhm,
something as subjective as feelings and emotions, it's very hard to remember how you felt yesterday, let alone a month ago. And if you're
mhm,
still feeling pretty rubbish,
mhm,
then you might not remember how rubbish you felt a month
mhm,
ago, for example. And that's why I think what you mentioned now is taking scores or screenings is so incredibly important. And I
mhm,
think, whether that's the generalized anxiety, GAD-7, or any of these kind of whatever, whatever it is, quality of life scales, as long as you can have a baseline and then, depression scales if you're depressed, and then you have an after one, and then
mhm,
maybe, as I speak about in my talks, I do a case study in this training on a pediatric case, on a child case
mhm,
of ASD, autism spectrum disorder, OCD, and anxiety. And in that case, doing a screening is a huge ask in and of itself. So
mhm,
there, you can't do it necessarily even every month. You need to kind of do the official screenings maybe in the baseline and then in 3 months, but you can do smaller little ones, or the parent in that case
mhm.
can do ones that the child then doesn't have to know about because that causes anxiety. And
Yeah.
you don't, in my case, the mother didn't actually notice a change
Mhm,
initially at all. And then we ran the numbers, and then we looked at how the child was 2 or 3 months prior, and it was nothing like how yes, the child still had a little bit of anxiety, still had OCD things going on because we didn't get very low carb, which is what I want to speak to you about. We didn't get as low as some of the diets that we're going to chat about today, but we still did get to like a 1-to-1 ratio. Um, and the fact is that it was clinically very significant changes. But
mhm,
because the anxiety was still there to a little degree, you forget. And then you remember, oh, that's how terrible it was. We were having meltdowns and tears and trauma and huge things every night. And now we're actually not at
mhm.
all, but you forget. And so I think it's really important. And I just wanted to emphasize that.
Yeah, and I love that. And we had something similar where a patient reported, just sent us a really lovely email the other day about one of my dietitians, and thank you so much. And he said, I didn't think the diet was helping me very much, but I went to the doctor and he performed, named off several, he did a bunch of inventories on me, and they were all improved. And the doctor is, of course, and most of these physicians, these psychiatrists, is a generality, most of them are not familiar. And he said, he's very happy and very pleased and told me to, keep going. And so that encouraged him because he wasn't seeing it, he wasn't feeling it yet, it wasn't enough. But his physician, who has been evaluating and been working with him, same just exactly like your patient. And so that's really exciting, and it helps us remember, because we need, as dietitians, we need to tell people, come on, it's okay. It's I tell people, if you don't want to try this for 3 to 4 months, then don't. In all honesty, to be, not to sound totally mean, but sometimes people will say, oh, I tried keto. I'm like, well, if you didn't do it for 3 to 4 months, please don't say you did, because
Yeah,
then you ruin it for the next person who thinks, oh, well, keto might not work because this person
exactly.
tried it for 2 weeks and it didn't work.
Yeah, so
And
that's another really important point, Denise, is that, and it's across the board. Everyone is saying, all the clinicians who have been working in this space and the researchers are saying, yes, you can get dramatic results earlier, but you want to give this 3 to 4 months and ideally work with a knowledgeable dietitian or a clinician in the space who can help you adjust it. And that is where, your lecture is so brilliant, Denise, is you speak about adjusting the diets for the patient in front of you. And how some people, like in my case, a child who there's lots of role players in that child's life, and the child is relatively resistant to doing the diet. So maybe there you have to go a little bit more relaxed with your
Mhm.
diet. But with someone who's highly motivated, like one of your cases, who wants to jump right in there, and start on a very high ratio, which means a lot of fat to relatively small amount of carbs and protein. It's a very ketogenic diet. You know, there you might see a little bit of a faster result, and you might be able to do that, right?
Well, you know what? And when people want to jump in really high, I mean, just because of experience, I really try to put the
Mm,
brakes on. One, I try not to let them start too quickly, although sometimes you can't help that. But where they get keto flu, they get a little
yeah.
acidotic and they have imbalances, because then someone can lose everything, right? They can lose their motivation, or their doctor can pull the plug and this made you ill, you ended up in the ER. So I try to give them slow your roll a little bit on that. But also when they want to do a super high ratio, and anybody listening to this, as dietitians, we think about ratios, and it's fat to non-fat. So it's fat to protein plus net carbohydrate. And that translates to your macro percentage. So a 1-to-1 being 70% fat-ish. And so when someone wants to start out and they ask me this and they'll say, oh, I want to do a 4-to-1. I want to do a 4-to-1 keto. I'm like, no, you don't. No, you don't. Or 3-to-1. No, no, you don't. Let's start back here. I'll start them at a 1.5 to 1% fat. And let's make sure they tolerate that, because I've had enough people who I've been dumb enough to let start really fast
Yeah.
and or really high. And then they get
Mm,
sick, or I can't eat all that fat. And then they're almost mad at you that you let them, try to eat all
mm,
that fat. And they're like, this is ridiculous. And so just over time and experience, you realize, no, their stomach needs to adjust, their eyes need to adjust to what that looks like. They emotionally need to adjust to that. And the adjustment might be just over a couple of weeks. It doesn't have to be a super long period of time. But yeah, when they want to jump in too hard, too fast, they flame out. They flame out.
yeah. So let's talk about some of those flames. So you mentioned, a potential for acidosis. You mentioned keto flu. I know that there's also potentially people on medication. There can be medication toxicity worries. Um, So, what are your concerns? Can you name these concerns and okay, you obviously start slow, but other things that you can do about them. So, what are the dangers of jumping into an incredibly high ratio, in other words, very strict keto diet, for treating mental illness? What are the concerns around that?
Gosh. So I think the biggest concern is that metabolic shift and probably, and I don't know anybody can exactly know, but the interaction with the medications that they are probably on um, could cause an issue where the medications might have more side effects. We see this in epilepsy all the time, where maybe you didn't have a side effect from your Depakote, but now you're in ketosis and you do. And
Mm,
so, or maybe you didn't have liver enzyme issues, and now diet plus medication, you have issues.
mm,
So the biggest concern is hypomania, even potentially psychosis with some of these conditions, or they could go the opposite way. They could have severe depression. Really, any of the mental health symptoms that they have could potentially be exacerbated.
on
Um,
medication, or even
I,
if they're not on medication.
I think either way, it could be exacerbated. And it's just that you have such a metabolic shift. I mean, if there's one thing I've learned over the last, 17 years in keto, is just, if you think you know everything, you absolutely don't.
Mm,
And I let the people teach me, because sometimes things happen that you just like, that can't
mm,
be happening, but here it is.
yeah.
Yeah, so back to the side effects. So those things may happen, and they could really have a mental health crisis. And that's obviously the last thing we want. We're trying to treat
Mm,
that. But keeping in mind that any medication, I don't know if any, but many medications that you put someone on may cause a mental health crisis also, right? Like a depression medication could make you more depressed, right? An
yeah.
antipsychotic could make you more psychotic.
Yeah.
So we don't, I don't want anybody to point fingers at the eye and say, oh, well, that could make someone
Exactly.
worse. Well, of course it could. But what do doctors do with medications? They have you start them slowly and you work your way
Mm,
up, and you don't
lean
start at
onto
your
it.
full dose. You don't put someone on the full dose of Keppra on the first day unless it was a crisis. And so, yeah, so we want to work up slowly and gradually. And when I say slowly, and I mean over like a week. I really am not trying to say, oh, you have to do this over a month or two. It's more that, and sometimes we'll use meal by meal method, or you can count down, drop carbs gradually. But some people are eating easily 200 to 300 grams of carbohydrate a day. And I'm usually shooting to get them in the 30 range as a starting point.
Yeah.
And you go from 200 to 30 just in one day. You might have some hypoglycemia, which means your blood
Mm.
sugar is going low. And when that gets low, you get shaky, you get grumpy. And then what does that
Yeah.
do to your mental health?
Yeah.
You can, any of us can get very irritable and angry
Yeah.
and frustrated and even pick a fight. And just because we've all done it in my family here. So
Yeah.
we can all do this if that happens. So imagine if you have this underlying mental health issue, of
Yeah.
course, that is
Absolutely.
exacerbated. So that's just hypoglycemia. And then acidosis is another one. And we say keto flu is, I didn't even know at first what keto flu was. Like, oh, we've been treating that in the hospital for forever. I didn't know it had that name. Somebody coined that name, was great. But when we started children in the hospital with epilepsy on the diet, and we started them, bam, day one, they're on a 2-to-1 ratio. So almost 80% fat, very high fat. And a percentage of them would get ill from that, and they'd be vomiting the next day, and they're sick
Yeah.
and they're getting dehydrated, and occasionally now we need to start an IV and we need to start bicarbonate and all these things. And after I started, and I just like, that's just why we should do it in the hospital, because they get sick, not thinking, oh, if
Oh,
you just
good.
did it
Wean them onto
slower.
it.
Oh yeah, so at some point,
Yeah.
when I started in private practice, I don't know, 8 or 9 years ago, I, of course, had to start people slower, and I didn't have the hospital, and we weren't going to draw labs every day. And so we would start slower and do this over a week or two versus over a day or two. And that mitigates a lot of the symptoms, a lot of the issues.
Yeah.
Very, very rarely do we have an issue if we go slowly. Um,
Yeah. So I
yeah.
think I think this is really important to see that this is what we're talking about here is a ketogenic metabolic therapy. And I
Mhm.
think that that's very, very key. We are talking about treating conditions, mental health conditions in this case, using a diet, yes, but it is a therapeutic diet. So it can be thought of almost like a medication in what it's in kind of how it's functioning, what it's doing, its pharmacological effects, if you will.
Mhm.
And so I think it's important that people bear that in mind, which is why it really is ideal if one does this under the guidance of qualified and knowledgeable healthcare professionals in the area of ketogenic nutrition and ideally mental health as well. And also ideally have a multidisciplinary team because you're dealing with medications, that maybe need to be weaned off or changed, and you're dealing with diet, where you have someone like Denise. To help you with the implementation of this diet and adjustment that might also be required. You might want to go more strict over time, or you might want to dial back, or you might want to try something different, or you might want to, there's a whole lot of things, which is why I think, you need a multidisciplinary team ideally. And I just wanted to emphasize that. And I also wanted to emphasize that this is why we're doing this course at Nutrition Network. It is to train healthcare professionals on how to administer this metabolic therapy in an appropriate and well-informed and evidence-based and safe way. And it can be done, and it can have incredible, incredible benefits. And in this training, you will also see some studies which show often complete resolution of severe mental illness.
Mhm.
Here we're talking about things like bipolar, even schizophrenia in some cases, depression, and cases of anxiety, generalized anxiety disorder, or specific anxieties. So we're seeing resolution of these things, much like in the epilepsy space. Long ago, we realized that refractory epilepsy, drug-resistant epilepsy in children could actually, it could be cured almost, or at least put into
Mhm.
remission.
We'll call it
Um,
cure. When you
well,
have
there we
no
go.
more seizures and no more
No more seizures.
medications, we're going to call that a cure.
Well, there we go. So this is a
Yeah.
powerful treatment option. And I just wanted to emphasize that as well. So we're not talking about a normal diet. We're not like necessarily, I know that in the metabolic space, those of us who who didn't come into this, like it sounds like you came into this, Denise, through hospital and treating epilepsy. You know, the dietitians such as myself came through it for treating diabetes and weight and metabolic syndrome and polycystic ovarian syndrome, where sometimes you can actually get away with a more relaxed ketogenic diet.
Mhm.
But this here, we're talking about a far stricter versions of a ketogenic diet, like you would talk about for cancer or Alzheimer's or other neurological conditions, like epilepsy, as you said, Denise. So I want to emphasize we're talking about something that a ketogenic diet that might need to be stricter and will need more supervision than if you're just using it to lose a couple of pounds. You know what I mean?
Yeah, and I think though also important though, like for example, we had a client come in the other day and he started just the first thing he did, he just cut out sugar. And he was already, and that was before our first appointment. And I met with mom and then we had our first appointment and she couldn't believe how much better he was
Mm,
just after cutting out sugar, just that one change. And so maybe everybody, I don't think we can ever say everybody needs this ratio, everybody needs this exact, right? This exact diet, right?
yeah.
It's a matter of what works for them, what low dose, right? And if 50
Mm,
grams of carb works and they feel better and their symptoms are relieved, then absolutely. But yes, a lot of people, we have to go to the higher levels to get them
and I suppose,
to benefit. And sometimes it's the
yeah.
time. I think
Mm,
too, over time, I used to think that there was some, and this is going back in epilepsy again, but that we would have these kids who we'd have them on the diet for 3 months and it wouldn't work, and we'd push a little farther to 6 months,
mm,
and they're like, okay, we're going to wean them off. So now it's getting into month, 7, 8. We really push, and we're doing this really slow titration down on ratio, very, very
mm,
slow, quarter steps at a time, and then they get better. And then we think, oh, I would think, wow, we found the sweet spot. We found, oh, it's a 2.5 to 1. And I used to think, yeah, and their ketones have to be 3 to 4. We looked and we just did what we knew and we thought, well, this is what's working. And what I think was working now, many years later, is they were on the diet for 9 months
mm,
and they were in ketosis for 9 months and or 6 months or whatever, a much longer period of time, and the healing continued to happen. I don't think that it was a magic ratio or necessarily a magic. I think it's the fact they were in ketosis, but it wasn't this magic number. I think it
mm.
was magic time.
So
So
then that's very interesting, Denise. Were they able to wean down to, would they ever, do you think those kids would ever be able to go back onto a relaxed keto diet, like what you would give to someone who might, okay, I suppose diabetes you don't treat with relaxed, but let's say someone who's
mm,
metabolic syndrome overweight,
mhm.
would you be able to get down to that kind of like, let's say 50 grams of carbs a day,
Mm.
maybe, and still
Yeah,
maintain seizure-free remission?
yeah, we would definitely try to do that for people, but sometimes with, I think in epilepsy, we keep learning in that field because I still work with that
Mm,
as well, although much more mental health now. But I think we've learned that, well, let me go back. Statistically, when after 2 or 3 years on the diet, when you take someone off for epilepsy, they have a 50% chance of maintaining the same benefit.
wow.
So that's great, which also means you have a 50% chance of getting worse. And so
Mm,
you take them off. So many people opt to stay on for longer, but then those that
yeah.
want to go off, a lot of times they do kind of have a self-imposed. We didn't really have a good structure at that time. I didn't have a
Mm,
good structure to keep people on a lower carb, but I would always encourage them, like, don't go back. Don't go back. So yes, that's more logical to continue
mm,
this more healthy. And usually by the time people have done this for a couple of years, they realize that bringing back cakes and cookies into my diet is not going to be good for me,
mm,
regardless of my epilepsy. So
yeah.
yeah, I think that we just, that there's definitely that legitimacy, although some people do go off the diet and they are fine, they're entirely fine.
So it
But
does show then, and this is something that Palmer says in his book, that there is a potential for healing provided you're on it. And he also says maybe for even a few years. It's
Mm.
possible that you've
Mhm.
healed to the extent that you could go back to eating hopefully a healthy diet, but maybe
Mhm.
not necessarily always a ketogenic level diet,
Yeah.
and maintain remission, which is quite hopeful, you know?
Yeah, I agree. And I'm really, as you know, and they're working on, I'm loosely involved, but not, there a lot of Dr. Palmer and some other people, they're working on guidelines.
Mm,
And I'm very excited to see what it's, I say guidelines, a consensus statement.
mm,
And that, I'm sure will, well, I don't know when it'll be out, but I know they're trying to get it done quite quickly. And I'll be interested to see, but what recommendations, but I do tell people at this point that if we can push this and be hardcore for a year or two, if you get the benefit, and then if you are to the point of saying I can do this very, strong for a year or two,
mm,
then yes, then there hopefully will be a maintenance phase for you that will not be the same strictness. And a lot of people just kind of naturally get to that because after being very tight for so long, they wear out. I mean, everybody tends to wear out
mm.
on that. And so yes, I really feel like that's where we're headed, and it'll be nice to have a little more structure with that because I think we're all kind of doing our own thing. And if we have clients coming in and they're feeling well and they're saying, well, um, yeah, I am being more flexible. And the woman I mentioned with schizophrenia that's working, matter of fact, I was supposed to talk to her last night and then I didn't. Um, anyway, she had been on the diet for 6 months and was virtually almost 100%. Let's say she still had a few voices, but almost everything else was great and she was managing well. And then she took 2 weeks off. She went to New York, she took a trip, she started eating pizza, she got home, she continued, and she went full out psychosis and was horrible. And she said, I would have normally been hospitalized, but my family held on, got me back on keto. And she said it took about 5 days to get me leveled out. She said it would have taken 6 months of medication adjustments any other time.
But that's exciting that she could
And
get back
yeah,
after five
yeah.
days.
And
And
she,
it
but
also
after
is.
5 days, she wasn't, but the rest of the story too, she wasn't better all the way. When I
Mhm,
saw her at 2 weeks, of course, I didn't know any of this happened. And I saw her at 2 weeks and I could see that she wasn't well. And she,
mhm.
and we talked about it. And I said, well, what percent better are you? And she said 80%. And I think it's more like 70. But okay, so 2 weeks later again, how much better are you? I think I'm 90% better. And I'm thinking 80. Just by looking at her face, just by looking at her
Yeah,
affect. And then another 2 weeks later, she was, I'd say, back to normal. So
yeah,
within about 6 weeks on her therapy, she pulled herself back from, from the depths of where she could have
yeah.
been inpatient psych all
Mm.
that time also.
So I can add to that story, Denise, the similar one of my own. So the case that I present in this training of this 11-year-old girl
Mhm.
who struggles terribly with anxiety and OCD and
Mhm.
many intrusive thoughts and even hearing sounds and things like that. She went off also for about 2 weeks, and
Mm.
it also all came back. It all came back. And we're in the process now of getting right again. So I was interested to hear your timeline. But I think what our listeners can take home from that is that this, again, is a therapy and you can't cheat and expect not to have repercussions, unfortunately,
Mhm.
because um, as Denise was explaining earlier, this takes time for your body to shift, which is why we have the slow
Mhm.
weaning on process. So you go from being primarily a carb burner and you have to change your whole metabolism to be able to rely more heavily on ketones, produce the right ketones, all those kind of things, and then change the all the knock-on effects that are associated with that. It's a process, and if you cheat, now unfortunately your body is it's kind of changed its equipment to burning
Mhm.
another fuel, and so I think that potentially you might even react worse
Mhm.
when
Yeah.
suddenly going back to eating pizzas in New York or whatever it is. Um, so I think this is a word of caution for patients and clinicians.
Mhm.
This has to be, taken. It's a bit like if you miss an antipsychotic dose, or
Well,
two or three
that
or 2 weeks.
Well, it's funny you said that. So, because I think it's a super common question. I'm sure you get it too, where people say, "Well, can I cheat? Can I just have, a cheat day or a cheat meal?" And I kind of hate that, to tell you the truth, because it just I don't know, it just gets you in trouble. Okay. But in all reality, most people are going to cheat at some point, right? I mean, there are occasional people that do this perfectly. The ones I find that do it perfectly are the ones with brain tumors. They don't cheat. I mean, I have those are the people I have that are like so-called perfect at it. But most people are going to they're going to make a mistake. They're going to have a letdown. They're going to have a couple pieces of pizza. I mean, pizza, something happens. And I tell people, I equate that to missing a dose of medicine. I say, you know what, you might be able to miss your medicine one day and not have a big deal. There might be enough in your system and you might be okay with that, not have a terrible day. Miss it twice, miss it 2 days, miss it 3 days.
Is it 2 weeks?
You're really miss it 2 weeks, you're taking your life in your hands. And what happens with food, like when you miss a dose of medicine, there's not really such an emotional, I don't think, as much emotional part of it. But when you eat something you shouldn't have, and you eat some pizza, and then you're like, well, I've already eaten pizza, so I might as well have some ice cream. And then, well, yesterday I already screwed up, so I might as well take today off too. So it really can build on itself very easily. And so it goes from one meal to 1 week or to one day, and it goes much longer. So that's the danger of it. So I don't like to like legitimize those things, but yet in all reality, you have to have a balance where people don't feel 100% trapped, or they maybe will say they won't do it. I spoke to a young
Yeah.
lady this week, and she said, if I feel, 100% that I can't ever do anything, I can't ever go out with my friends, I can't ever do this, then I'm not going to do this. Like,
Mm.
we will work with you. We will figure it out. We
Yeah.
will make it work. We will help her figure out how her life works within this.
Yeah. And I think
And
that's really
it may not
important.
be
And you
all perfect.
and Denise, you speak about that in your lecture as well. And so I know we're drawing to the close of this session, but I wanted to speak a bit more about that now that you've touched on it. The way that you can make this bespoke, or you can adapt it for there's certain flexibility built in to ketogenic metabolic therapies to allow them to be able to be applied to different people within different lifestyles, and even within different dietary choices, right? So you
Mhm.
even speak in your lecture that, and this is always something I struggle with, that even vegans
Mhm.
are able to do ketogenic metabolic therapy. Can you tell us more about the flexibility around this and how this therapy can be adapted for different people and their needs?
Yeah, I mean, so many people come in with food allergies or avoidances, and at least specifically in the US, so many people need to avoid gluten for the various reasons. That's another story. Where they have to avoid dairy. So we're going to modify for that. I mean, if you can't drink cream, then you don't use cream. If you can't, right? If you can't have gluten, which generally it's easy to just take gluten out, although there's so many gluten-filled keto products now, which are probably not going to support ketosis very well anyway. So you're probably better without them. Anyway, so specifically with vegans, we tend to go toward what's traditionally called an MCT diet, which is a very high percentage of calories from MCT oil. And the MCT oil, medium chain triglycerides, of course, that produces ketones better and quicker than your long chain fats and your olive oil and your avocado oil and your coconut oil. Coconut oil is where we get the MCTs. So we get that percentage up. I try to use MCT oil with every single person and get it up to 25% if I can on them, because that can make the difference between
25% of their fat or
of
25%
their
of their
of their
overall calories?
calories, of their calories. I mean, and I'm not legalistic about that, but in general, because and I'm sure you know this, with the MCT oil, they are able to produce ketones with a few more carbs and a little more protein. And so just like with the vegans, they need a much higher carb allowance in order to get protein. They cannot get enough protein on 30 grams of carb or 20 grams of carb on a vegan diet. It doesn't work. They're going to have a protein deficiency, and we're going to have problems
Yeah,
downstream. You might be
yeah,
able to do it for a very short time. They're going to be very unhappy. So they need to have whatever 50, 60, maybe 70 grams of carbohydrate, but it has to be bathed in MCT oil generally.
Mm,
And so that's what we do with that. But if you translate that and say, but what if everybody used MCT oil or a lot of
mm,
coconut oil? And then they don't have to be as restrictive. So
yeah.
I'd rather have a looser diet with MCT for all, unless there's some
Mm,
reason. Occasionally there are reasons people can't do it, but I really work hard to build that in.
yeah.
So
Well, I think that's really great. And I think, Denise, you have shown us how, and I think this is the biggest take-home message, uh, is that people have hope.
mm,
I think that's what's the most exciting thing for me about this whole therapy
yeah.
is that when people who have tried 28 medications and are still living a life of torment, really, and often that's really what it feels like when you are struggling with mental health. It's like it's a life of torment. And you have tried everything, CBT therapies and hypnosis and all sorts of things and all the medications, and you're still not better. The fact that there is still hope and that
Mm.
you can get better, I think that's so powerful. And that the research and this isn't some quackery. The
Mhm.
evidence is
Mhm.
mounting in this space, and we have so much anecdotal evidence from clinicians such as yourself, Denise,
Mhm.
that this is making a real difference in the lives of real people who deserve to be well, you know. And so I just wanted to end with that. But Denise, what do you want to end with? What would you
Oh
like to
gosh.
leave people with?
Well, imagine what happens when we don't wait until people have tried 28 medications. Imagine the efficacy of something that's tried early on or first, or we get to the point of prevention.
Yeah.
So I guess I want to say that my goal is that this is, and just like this with an epilepsy too, and other many other
Mm.
conditions that this works, or migraines, where we say, why would we try all of these medications first? Sometimes there's a
With their
safety
side effects, right?
reason, right, with their side effects, and many times there might be a critical acute crisis where you need to use medications, and absolutely.
Mm,
But why would you not first say you're going to have to stop drinking your Coke? It's going to kill you. You're going to have
mm,
to stop doing this. Instead of saying, because I think what I used to say as a clinician, I would say, oh, well, people aren't going to make all these changes, but maybe they can make a couple changes. But I didn't tell them they'd get so much better if they made all these changes. Like I didn't have the belief. And
mm,
and when I got into keto and I started seeing people and parents and people saying, "Oh my gosh, again, I got my kid back," I realized this is powerful.
mm.
And what's exciting, and I know you've done this a while, is when you get these dietitians and clinicians in this area, we don't leave. There's nothing I've ever done in my life and my career that's so life-changing as this. When you leave work and you say, yeah, I helped someone with schizophrenia get a job today. I mean, it's
Yeah.
just it's just overwhelming to think that you help somebody that much, that they help themselves, right? They did all the work. But I handed them some tools and then they could take those tools
Mm,
and go to work and do it. So then that's where, like, the dietitians on my team, they've been the minimum experience. We have 100 years experience amongst us, and the minimum is 6 or 7 years. And
yeah.
because when people start doing this, why would you leave? Why would you leave
Yeah.
when you can help somebody that much?
Exactly.
So yeah, so I
Exactly.
haven't worked for years. It's not work when you love it and it helps people.
When you can really, really change
Mm.
lives.
Yeah.
So, I mean, join the ranks
Mhm. Yeah.
and take the training and
Mhm.
learn how to change lives, make a real difference in people's lives. So thank you so much, Denise, for joining us, and thank you to all of
You.
our listeners. And I hope that you've come away with feeling inspired and with hope. And for all the clinicians, I hope that you can really use this to make a